Okay, abdomen and thorax self-evaluation. Start with ABCs, airway, breathing, circulation, and check the past and present history of your patient. Look for any unusual sounds that may be pneumothorax, such as crepitus, or any sucking sounds. Any unusual sensations, nerve problems, breathing problems, whether the chest is coming up and down at different times, something like that. Inspection, the usual swelling, discoloration, deformities, abnormal breathing patterns, whether your patient may be going into shock, any other signs of pneumothorax, maybe the chest is compressing differently, something like that. Deviated trachea, right here, whether it's down the middle, off to one side, that's never good. Hematitis, if the patient is coughing up blood. Hematuria, where they may be peeing blood or blood in the urine. Check for breast contusions and nipples, see how they are. Palpations, bony palpations, starting with the clavicle, the shaft, sternoclavicular joint, acromioclavicular joint, sternum, manubrium, body, xiphoid process, just below the breast line. Ribs, checking for fractures, bodies of the ribs, which are a bit hard to palpate at times. Costochondrial joints, where the ribs meet the cartilage, and costrosternal joints, where the ribs meet the sternum. Okay, thoracic vertebrae, we're gonna be thoracic vertebrae, center of the back right here, as well as looking for costovertebral joints again, where the ribs once again meet the cartilage. Okay. Soft tissue palpations, pectoralis major, intercostal muscles, or the muscles between each rib. Rectus abdominis, the middle part of the abdomen right here. Internal and external obliques, right here. Okay, and abdominal quadrants, upper left, upper right, lower right, and I would again check for breast contusions, anything like that. All right, specialized tests, abdominal rebound pain test. So with the lower right quadrant, the patient laying on their back, pushing inward if there's any pain when pushing in, or if there's any pain on the rebound on the way out. Okay, rib compressions, checking for fractures, any pain, anything like that. Forced inhalation, ask the patient to take a big breath, as much as they can take in, as well as forced expiration, which is blowing out all the possible air they can. Kerr's sign, which we talked about, a spleen injury that could possibly be leading to irritation or pain in the left shoulder, something to be aware of. And McBurney's point, or appendicitis, which would just be a few inches to the right side of the navel right here, belly button. Range of motion, active or passive range of motion. Trunk flexion, stand up, lean forward, extension, backwards, rotation to the right, rotation to the left, as well as lateral flexion to the right, lateral flexion to the left. Muscular strength tests. These will be a little hard to do by myself. Okay, for the rectus abdominis and internal and external obliques, trunk rotation, which would be a sit up right here with someone pressing and them trying to move inward. Rotation. Trunk flexion, testing the rectus abdominis, internal and external obliques again, as well as a transverse abdominis, just to sit up against some sort of resistance. Trunk extension for the erector spinae. Have the patient lay down on their stomach, come upwards. Okay. Lateral flexion for the ipsilateral flexors, ipsilateral extenders, and quadratus lumborum. Laying on either side. Normally go bilaterally. Just go this way. See how that is. Any pain? And for the intercostals and the diaphragm, respiratory muscles, which we tested during forced inhalation and forced expiration, if there's any pain during that. Neurological test. Okay. Motor. Beaver's sign. Have the patient lay on their stomach. Watch the umbilicus. If when they go to a sit-up motion, if it starts to move upwards, that may be a bad sign. There could be some injury there. Right. T1, I'll stand up for this. T1, side of the arm all the way to the armpit. T2 and T3 are the upper breast area. T4 is right here at the nipple line. T5 just below that. T6 at the navel line, or xiphoid process, I should say. T6 at the xiphoid process, just below the breast. T7, 8, 9 are between just above T10, which is the navel line, right here. T11, this area, and T12 being the pubis area above the inguinal ligament, right here. Blood flow tests. Don't have access to any blood pressure here, but I'd love to learn, so.